What is a ganglion cyst?
Well, a ganglion cyst is a fluid-filled mass, and it leads to a bump on the top of the foot or around the ankle or around the wrist.
Does it hurt?
It usually doesn't hurt, but because it's a lump, it can rub up against your shoe wear, and that can be uncomfortable.
How do I treat a ganglion cyst?
Well, you're mostly going to try and treat it by making it as comfortable as possible, making sure that you're wearing shoes that don't irritate that particular area, or sometimes putting padding around the ganglion can help if it's creating discomfort.
Will it go away without treatment?
Sometimes they'll settle down and disappear without treatment, but that's relatively uncommon.
What is the surgical procedure for removing a cyst?
Well, if it's significantly symptomatic, we can remove the ganglion with surgery. So we remove that mass and also where the mass originates from, usually a joint or the lining of a tendon.
What could possibly go wrong with it?
Well, like any operation, there's always a chance for a complication. Fortunately, that doesn't happen very often with this type of surgery, but you can get wound healing problems. You could get an infection. There could be nerves in that area that could be irritated. It's very unlikely, but you could get a blood clot in your leg or a blood clot that breaks off and goes to your lungs. And probably what we see occasionally with this is a recurrence, and that is one of the things that's a complication that's specific to ganglion cysts.
How long will it take to recover?
Well, it's like having a cut on your foot. So it's going to take 2 or 3 weeks to heal, but there'll be increased blood flow to that area for a couple of months. So it does take a fair while for it to completely settle down, and you usually have to take it a bit easy during that time.
How would you summarize a ganglion cyst?
Well, ganglion cyst is a fluid-filled mass. It causes a lump on the top of the foot or the wrist. It's usually not that painful, but if it is, we may need to remove it surgically.